Hello, everyone. Welcome back. We're going to turn it. I'm going to turn it over to Daniel Serta, program officer at the Greater Kansas City LISC office. He's our great moderator. We're looking forward to a robust discussion here. I know I told you to do this, Daniel, but I'm talking, so I'm just going to go ahead. After this panel, we're going to do some roundtable breakouts. We'll have a break and then roundtables. If on the back of your clip here, you should have a number that's going to indicate which session you signed up for as part of your roundtable discussions. There's flexibility, so you can move wherever you like, but it's they're going to be hosted by some of our subject matter experts, so you'll have opportunity to dig in, ask questions. So while there's no specific Q&A session as part of this panel, we'll have the opportunity post. So more details on that after the panel. I'll hand it over to Daniel. Thank you.
Good morning, everyone. It's a pleasure to be here with you today. It's so great to see so many faces from so many places that are all dealing with the same challenges we've dealt with. I want to just reinforce something Bevan said. We're not formally going to take Q&A during the session because the idea is that this conversation, this dialogue will translate and transition directly into the breakout sessions as we move into those afterward. So I'm going to start by asking each panelist to briefly introduce themselves and describe the role that they play, and most importantly, to address very briefly one reason their role in supporting childcare systems, building, and infrastructure work is so important to them. We're going to start at this end of the panel with Kevin Ford. Why don't we switch?
Hey, there we go.
Okay.
It's working. Okay, I got my timer on here. They said keep this. They said keep this 2 minutes or less. So I'm self accountability. Thank you all. My name is Kevin Ford. I'm with the City of Kalamazoo, the Economic Development Team from the greatest state in the Union, Michigan. And my work, I'm the coordinator for Shared Prosperity Kalamazoo. My work works around ensuring that no matter where folks reside, they have what they need to thrive fully. And this work is important to me because is a quote that I came across a long time ago. Children do well when families do well, and families do better when they're in supportive communities. I remember how it was when I was growing up. My peers, folks in my community, I understand the importance that children, they don't live in programs, they live in families and communities. So this is deeply personal to me, and that's why I'm engaged in this. Made my time.
Yeah, good job. All right. Good morning, everyone. I'm Michelle Bauman. I am a developer with Edison Community Partners, which is an affordable housing development company, also based in Kalamazoo. I would say the greatest city in the greatest state of Michigan. Prior to joining the team at Edison Community Partners, I spent 7 years working for the Michigan Economic Development Corporation, which is the state of Michigan's economic development agency. And in that role, I was a regional representative working with municipalities, developers, nonprofit organizations, and community partners to help them figure out how to access state programs, which are not always easy to access. For me, the most important kind of reason that I have connected with the work around childcare outside of the benefit that we know can be realized through co-locating childcare with our affordable housing projects is actually as a parent, having experienced what it can look like when you have subsidized childcare made easy, as well as trying to find childcare on the open market during COVID. You just can't overstate the importance of that resource for families and supporting families in having better economic outcomes long term. So thank you.
Good morning, everyone. Alexis Bustamante Delaney. I think I'm going to ask Kevin if he can do his 2 minutes for me, just so I can keep an eye on it. Thank you. I work with Guadalupe Centers. I'm the Vice President of Early Education and have been with Guadalupe Center off and on since 1988, when our preschool was just 3 years old. So I've seen us through a couple of different locations, and currently we're at the Penn Valley campus. One of the reasons that I'm so committed to this, especially with our dual language programming, is because I was one of those children who only spoke Spanish and have a very dark memory of what the preschool experience was. So I think it's critical that for any child living in our country who has a different home language other than English needs to be valued. And first of all, that we need to understand they will learn English, whether it's taught or not. They will learn the English. However, the risk is that they're going to forget their home language, and as a result, we break the family unit, which is critical to the success of a child for the future. So it's imperative that we recognize and assess that child's knowledge in both languages. If we fail to do that as educators, we're going to miss the opportunity to give the world these productive citizens who can do any job in 2 different languages. And I think that would be a waste. And we need to recognize them as having an asset with their bilingualism as opposed to a deficit. Thank you.
Hi, I'm Dr. Tony Sturdivant. I'm the Director of Early Learning for the Mid-America Regional Council. To answer the question about why systems work in early childhood is important to me in my role is because I've had many different roles in early education, from being a teacher, from being a coach of teachers, from being a professor, researcher, author, nonprofit executive, all of the things. So I've benefited from programs that benefited from good policy, that were well resourced because of it, that was able to have a strong workforce because of the resources, because of curriculum choices that were able to have great quality. And then we saw child outcomes increase. And because of great parent involvement, we saw parents change their lives and change the trajectory of their families. We were able to inform policy and procedures through good data. So because of this, I am aware that a good quality and effective early learning system is a system. It is not just about what is happening in any individual classroom or any individual center or home, but it's the whole context in the environment. And so because I feel very strongly about the power of quality early learning, it has to be looked at a systems level in order to continue this excellent work that's been happening for many years.
Hello, my name is Clyde McQueen. I'm president of the Full Employment Council, and we run the public workforce system for a 5-county area on the Missouri side. Our population is about 1.2 million people, and we service rural, urban, and suburban communities. We're the only one in the state of Missouri that does such. Why you're in this work, it goes back to when I worked in Texas at what the time was the Texas Industrial Commission, the Texas Economic Development Commission, the Texas Department of Commerce, and who knows what else. But I never will forget, we had just landed a project in Houston, Texas, and this was like in 1976. And at that time, we notified State Representative Mickey Leland, dear Representative Leland, we just landed 3,000 jobs in your community. And he wrote me back and he said, dear Clyde, who got the jobs? And guess what? It wasn't us. And so from that, I said we need to do more to make sure that these activities impact the communities in which we live, people whom I know, and families like mine. And that's the reason why I'm in this work.
Excellent. Thank you, everyone, for your introductions. I want to move to really the first major topic we're going to talk about, which is developing and sustaining partnerships. And I want to ask a couple of related questions and have you each address, and then I'm going to come back with the follow-up. The first one is, within your individual networks, who are the leaders or entities that have really driven the push for collaborative action around childcare? And as a related issue, what mechanisms have you been able to create to convene those partners for planning and decision-making? And we can go in the same order.
In Kalamazoo, we have WE Upjohn Institute. They do workforce and employment research. Within that, they have Pulse at Upjohn. They're regional early child care convener. And so they've been a very large and instrumental organization in pushing this forward. To have changes at the state level. They help develop our Region 8 child care plan. And so they've been instrumental. Our city commission has been instrumental in terms of just the shared prosperity overall and understanding the importance of early child care. Our YWCA has been instrumental. They do work already around infant mortality rates through Cradle Kalamazoo. And so they're just a natural partner in this space. There's been a local collaboration between our Literacy Council, the YWCA, and Southwest Child Care Resources. And it's the Edison Early Child Care Education Career Pathway. They focus on developing early learning professionals. They've also been a huge driver in terms of the early child care ecosystem in our city, as well as LISC in terms of funding and being creative in how we address this.
Yeah, so obviously all the things that Kevin said. As an affordable housing developer, we also work in other communities outside Kalamazoo, so we work across the state of Michigan. So one of the projects we're working on is right down the road from Kalamazoo in Battle Creek, Michigan. And so just a couple additional partners I would highlight in the context of that community. The W.K. Kellogg Foundation is headquartered in Battle Creek, Michigan, so they're a critical partner for us on a specific project. So I think the answer in terms of who are the partners and stakeholders can be different once you're actually working on a specific project. And then, of course, for us, because we are affordable housing developers, the Michigan State Housing Development Authority, MSHDA, which is the entity that allocates low-income housing tax credits in Michigan, is, of course, a critical partner as well, because without that funding source, we would not have a project. That is the primary source of financing in the project that we're working on in Battle Creek.
Thank you. For Guadalupe Center, which has been serving the Hispanic community for over 100 years now, we've always had a bilingual program in our early childhood. But it was really not until we started working with Head Start that Head Start questioned us, and they really asked, why are you not doing a dual language program, a model, a structured model? And it got us to thinking, well, what are the benefits? So we started investigating it, and with Head Start's support and advocacy as well, and we looked into it and decided there's nothing going on across the region that is a true dual language model. So we needed to do that for our children. Research showed us that it was more beneficial for children. So we began the process right before the pandemic. We were backed by a lot of local funders. One of them was the Stanley Durwood Foundation. Another was the Baum Foundation, and the Kauffman Foundation, which has been key in the field of early learning historically here in this area for over 20 years. With their help, we were able to access an instructor from K-State University, Dr. Socorro Herrera, who in her field of dual language learning had tackled everything but early childhood. So she has been instrumental in supporting us, and we have gone through a pilot. We also worked with our own charter, and as I mentioned, the pandemic hit, and that bumped them out. That really just didn't fit for them. Everything was virtual. We soldiered on the Guadalupe Center preschool side and went through that process, and now we're at the tail end, just working on the assessment pieces of our dual language model. And it hasn't always been easy, but we can talk about that a little bit later. But those are our partners, as well as the community college where we are located. We've always been their lab school, so we have been negotiating with them and partnering with them, specifically in the field of early learning. So we'll talk a little bit more about that as well.
Hi, so Mark, who I work for, is a regional planning organization and is actually a federally mandated sort of entity that has to exist in terms of transportation. And so sometimes people are like, where did early learning come from? So got a little bit of history. So I want to share that before I go into some of the coordination that I've done. Is in 1989, a brilliant mind, I have to say, because in 1989, for someone to say early childhood is a community issue, it impacts the whole community, and it needs diverse people brought to the table to think about how to improve it. And so this idea of, if we want to improve our quality early learning system in this region, we need to talk to all of the entities, right? We need to talk to the providers, we need to talk to the businesses, we need to talk to government, economic development, all of those things. And so I am also from Texas, as Clyde said. So when I arrived here just like a year and 3 days ago, a lot of early learning work had already begun. Mark was already the Head Start preschool and early Head Start grantee for 3 counties in Missouri. There was already many quality initiatives that were happening throughout the region. There was already a standing group called Partners in Quality that met and talked about what's happening in the region and in terms of early childhood. So when I got here, I needed to understand the landscape. And some of the first people I met, Deidre Anderson, she's in the room. I think you'll hear from her, hopefully, or talk to her because she's a wealth of information. And then Paula Neth, who I saw as an attendee, but I don't see her yet. Okay, she's coming. So one of the first things I did with them is say, hey, we need to look at the system. Who are the people that needs to come to the table? So I'm like, we need someone in economic development. They're like Greg Kendall, who is right there. We need someone in workforce, and they're like Clyde McQueen is right there. And so we really crafted this list of this cross-sector list of people, from higher ed to providers to parents, all of the areas. I cannot overemphasize how this touches every area of community life. And if people don't know that, then they just need to have a further conversation, and they realize that they are impacted by early care and education. All of us are, whether we realize it or not. And so, as you heard from Eric, we were able to form a planning group called Connecting the Pieces. So connecting the plans to improve the early childhood education system, because I realized there were lots of organizations doing a lot of things that were great, but they were siloed, and that we could be more effective and more efficient if we were talking to each other and planning together. And so with the help of the KC Chamber, with the Civic Council of Greater Kansas City, Kansas Action for Children, Kids Win Missouri, and lots of other, I think we are like 49 organizations plus parents in now, are working together to help improve this at a systems level, and that work is ongoing right now.
Thank you. Well, actually, we didn't get that involved in child care because it didn't pay enough. And as a workforce system, we have certain performance standards that we had to meet, and $13, $8, $20 an hour would need to meet our performance standards, so we'd be written up. And so the child care community in Kansas City is very strong. She mentioned Deidre Anderson, Head Start, Early Start. They are everywhere. And I think it's very important to know that they are a very strong entity, a system that are always talking and never turning back. And I think that's what helped us eventually approach the state of Missouri. And they made $3 million of ARPA money and say, do a child care apprenticeship. It's the only way we can do it, because you don't make enough. And because of that, we were able to get the wages up from $13.50 to $16.50 an hour for those apprentices. But what happened was the constituent group, because it's such a complicated industry, people don't think that childcare is, it is very complicated. It is very complicated. I can tell you, I marvel at what it happens inside those walls and the things that people must do, the innovation. And so because of that, we said we had to make this a mainstream because it supports everything that we do. When we start talking about economic development and workforce participation, but for that, and Deidre, she be in my ear 24/7, just like she's sitting over there right now, leaving me these 30-minute voicemail messages. My phone would blow up, but I can tell you that the constituency, and I want the persons in this room to know that that is very effective because people do not understand your industry. And you must keep there. It took me 15 years to learn. It might take others more, but I think that was a very strong aspect that you represent in terms of that.
Thank you, everyone. I mentioned I had a follow-up, and I want to couch this in a phrase that Kevin used, which is the notion of ecosystem. We talk about that a lot in the small business work that I do and support here at LISC, but thinking about that in the context of the childcare work you're engaged in, I want to ask you sort of the inverse of what you just talked about, which is who's not at that table? Who that you might have approached in the past that didn't come in or that you haven't been able to get engaged with, do you think would be really essential in the process in your work going forward?
It's a couple populations I can think of. One is the private sector. At home, that's a constant challenge, is getting them fully engaged. Another population, the families that need it the most, right? So they're struggling with life and the challenges of life, and getting both of those populations in the room. There are also knowledge gaps between. So the presenter talked earlier about policy and had all the wonderful information about that. A lot of families and residents in the neighborhoods I'm trying to affect, they don't care about that. They can care less, right? But it's important in terms of the overall ecosystem and how we enact change in that ecosystem. And so dealing with those knowledge gaps, folks who were most directly affected in terms of, like they say, those closest to the problem, had the information, they just don't have the resources. So that's a consistent gap at home in trying to bring those populations together. And this is another element. Quite frankly, some folks in the room, in terms of shifting their mindset, that's been another challenge I've observed in terms of engaging in this work. It's not so much bringing new folks into the room, but getting the folks already in the room to understand, like, it may not be what you think it is. And right, how can we innovate within this work to really affect change?
So I think as an affordable housing developer, but also when I was working at the state and working with a lot of private sector, more traditional like market rate developers, that is a group that has the potential to be very helpful. Earlier in talking about some of the various federal funding sources, LIHTC was up on that screen. That's a very powerful tool. It would be better if we just had programs directly for childcare, of course, but there's kind of a both and here, I think, right? You got to work with what exists today because there are people that need childcare yesterday. And so reaching out to private sector developers who may be able to be helpful in terms of solving for some of the space costs, kind of being able to, for example, with the LIHTC program, we can help by building that white box, and then we're only solving for how we fill the box, which is not the perfect solution, but is something better than nothing, right? So I think leveraging state or local or regional programs aimed at real estate developers to try to figure out how you can encourage them to be creating space for providers so that you're just adding another layer of subsidy to help try to solve for the financial sustainability of that child care model.
I can say after Nicole's presentation, definitely I learned a lot about who's not at the table. So that was very helpful. In addition to that, I think people that work in this field are so passionate about it that we sometimes forget or don't take the time to learn how to give that speech for legislators. Legislators want to know a quick, and we heard that again today, this morning, what do you need? How can we help you do it? And that's it. Get me in, get me out. Just like it was stated, you know, the legislators know a lot about everything. And it's up to us to transfer our passion into how do we truly become more effective. I see the red folder. Okay.
They want to say something.
Do you have anything to add? All right, well, Alexis, you have teed us up exactly where we need to be, because what we want to talk about next is data and how each of you are using data to support equity. So I want to really have each of you talk about two related themes there, which is how have you applied data to engage diverse partners and help build your case for childcare, as well as how to guide your work. What kind of new insights did it reveal to you and to others about the work that you do and how important it is? And then to talk just a little bit, without going too far into the weeds, about who led the data collection efforts and how data will continue to be monitored and evaluate progress. And we don't necessarily have to start with Kevin. We can start at the other end of the table.
Data is very important. I have an economist on my staff who does data on everything, because otherwise it's always, Clyde is such a passionate person. You know, we need to talk about the reality of our economic environment for the communities that we serve. And so we lead with data first, so it can show that when we're talking about just something in single parent families, people always think of people raising kids by themselves, divorced. No, I got friends, they got two houses. They stay with one time, they're not divorced. They're parenting. It's different. And so understand that the methods, and this is a different time and place, and sometimes we operate off of perspectives from like 20. We need to quit condemning folks. We live in a different time. And that's the one thing that data does. It's objective. It gives you a frame that people can access, and it's not something that somebody can tilt. And that's what we always try to lead with data, because it's very, very important. And we put it in everything that we do first, not last. And then I can be passionate.
So the Connecting the Pieces initiative is a big part of it is data collection and reporting out that. So we looked at things like demand. We looked at census data to figure out what the demand was, the gap, provider capacity, which is interesting because license capacity and how many actual seats there are is not the same thing. So that's a little tricky. We looked at wait list, average wages, provider costs, parents' experiences. And so there different people within the community have used the data that we've collected. I've partnered with Kids Win Missouri, who partnered with IFF to lead some of that data efforts. So they looked at the child care market rates surveys for Missouri and Kansas, as well as some provider parent and employer surveys that were created for this initiative, and fiscal mapping for Head Start, Early Head Start, and school district facilities within our region. And so now we know things like we need more than 30,000 slots to meet the demand of all of the children who have both of the parents or all of the parents in the household working. So like that is a hard number that we have that we can bring to a stakeholder group to understand the gravity of the issue. As far as looking at how to keep this going, Dr. Mary Elsman, who's also in the room, is actually the chair of our data and metrics work group out of Connecting the Pieces. So we're looking at not only understanding what the problem is right now, but how we can track the progress and improving the problem over time so that is not just left. And so I think that one of the things that I find is great about Connecting the Pieces, even though it is not designed to be an ongoing project, but we are building the handoff to a standing community committee that will keep the hold the system accountable to the goals that we set, and then create new goals once we achieve them. And so I've mentioned Partners in Quality before, which is also a diverse stakeholder convening group, because that's what Mark does, is diverse stakeholder convening groups that will be able to look at the data sources to see how we're improving towards those goals, and pivot from there. But one thing I did want to say as a qualitative researcher, numbers are great, but I think hearing the actual narratives of some of the families and providers have been very impactful. So hearing parents say things like, I want my child to go to a quality childcare center, and so I live in this place that I don't want to live in so that I can afford to send my child to this place. And once my child goes to kindergarten, we will move to a safer neighborhood. That's something that you can't capture in numbers. And I think that it's very important for people to understand the types of sacrifices that families are making for the well-being of their children, and being able to hear things from providers like, we're trying to recruit back employees that have left for other sectors, and we can't compete with the wages of fast food restaurants. And so like, that's not, I mean, even though you can see the average wage for the industries, I think hearing someone say, no, someone told me they will come back if I can pay the same wages they make in fast food, it just feels a little different than just looking at the average wages. So I just want to say that yes, numbers are very important, but do not underestimate the power of storytelling and qualitative data in getting people to change behaviors.
I think that's what I have to say is going to follow along with Dr. Tony. The data we have in this dual language program is from the Desired Results Developmental Profile. If you're in early learning, you're familiar with the DRDP, which is key for our children as they transition on from the early childhood programs onto their elementary schools. So this information, even though we've worked hard at this dual language implementation, it is not going to give you all the beautiful numbers that you wish you could see, because we're still a work in progress, and initially it's going to look lackluster in specific areas that we want to see improvement in, which is literacy, language development. But those numbers are high in the social emotional and in some of the physical attributes. So we know that if we're patient, we are going to see an uptick there. And more importantly, that uptick is going to be visible, we're projecting, in the 3rd grade, in the 4th grade. So data isn't always giving us exactly what we want, as Dr. Tony says, but we have to write it out and know that that's going to improve.
So definitely echo everything that's been said. You need the qualitative and the quantitative to really tell the story. For us, a data source that has been very helpful, coming again through that housing lens, is the ALICE data set, which is something that the United Way puts together and really helps folks understand from a household budget perspective. For example, how many jobs does a family need to work if you have one parent and 2 children? And it's like 4 jobs full time in order to afford just a basic survival budget. And so when you combine that with some of the qualitative stories that you hear from the families that are struggling with this, that can tell a really powerful story. And breaking it down on that household budget level is something that I think, you know, everyone can kind of relate to and connect with. And it really becomes very clear, especially coming from that economic development background, when you're looking at the wages that someone needs to earn just to survive, and you're looking at the wages that are being incentivized with dollars from the public sector, and those two things do not line up, it's very clear that there's a much bigger problem at hand.
We also use the ATLAS data from United Way. That's an acronym for asset limited, income constrained, and employed. Essentially, it's families that their income is too high to get the child care subsidies, but not enough to make ends meet. So it roughly is about 2.5 times poverty rate, the federal poverty level. And so we use that. Pulse at Upjohn has done the regional survey. They've done the quantitative stuff, the qualitative data, like Dr. Tony said, and just hearing from providers in terms of wages and that workforce and economic development piece of being able to keep people. The wages is a huge thing we've learned about. Hearing from parents themselves and like the challenges they go through. So using that data, but the city itself hasn't been at the fore of like collecting that data. It's been relying on partners that are knee deep in that ecosystem and relying on them. In addition, we do use census data in terms of just like poverty rates, things happening at the neighborhood level. What I've found is like most of the folks in our community are tapping into the same data pool. So like the census, everybody uses the census data, right? It's just fleshing that out to whatever they're trying to achieve. And so we use a lot of the same data sources. But again, the challenge is, even though we got the data, like how do we use it most effectively? How do we use it in a way that's not weaponizing against organizations and folks trying to do the work, in addition to families? And how do we collaborate with the data that we have?
One thing I was going to say, one thing we should really look at differently is the unemployment rate is an undercount. It is 3 to 4%. We should really look at workforce participation rates. When you look at workforce participation rates, it shows you that the workforce participation rate of women is 10% below that of men. When it goes into persons of color, it drops another 10%. And so that's not as easy to get, but that should be something we all look at, because that reflects the rate at which people are actually working inside the labor force, applying for jobs, et cetera. Unemployment rates is only measured by going to organizations like ours. A lot of folks don't come to our office, don't want to be on the book, but they are and still participating in the economy, so we should ask those questions.
Thank you. I mean, all of that to me is incredibly, the way you've described data and how you're using it in itself, just hearing those stories, I think are impactful. I want to tie this briefly, we have just a minute, back to the earlier question, because it strikes me particularly in what Michelle and Kevin were describing, as well as what Alexis was talking about, that sometimes you're engaging with an audience that not only doesn't know how to apprehend those numbers that you're collecting. I think Alexis alluded to that. Sometimes the numbers don't look that great on their face, but they don't get the context, right? They don't understand. They don't have the on-the-ground exposure. They don't understand necessarily what the question is that needs to be asked about that. And Clyde addresses that as well. So again, in terms of how you make the case for equity with the data you're able to collect, I'm just curious if any of you had any stories you'd like to share about bringing someone in and persuading in a way that might not have happened, but for having, whether it's the narrative or the numbers, to really build that case.
I can say that for the dual language program, we have the research that demonstrates that those gains will be obvious by later on in that child's educational career. So that's impactful, and what we're doing is going to add to that data. So we are looking at other grants that are available that will help us do a comparison, a control study with perhaps even our own charter, who is not implementing the dual language. They might be the most ideal partner. If not, we can search for another one, but we're in the process of doing that right now too. So we want to firm up the data and either confirm what research has shown with the elementary schools, or show that in early learning, the vast benefit for children and families as a result of our work.
Excellent.
I can give an example with the project that we're working on in Battle Creek, which is a mix of affordable and what we call in Michigan like workforce or attainable housing. So 80 to 120% of area median income is kind of that higher income band, where, like Kevin mentioned, someone's still working but still couldn't afford a market rate apartment. And so as part of that project, we are trying to not only leverage the low income housing tax credit, which is the primary funding source, but also some funding from our state economic development agency to help fund those more attainable workforce housing units. And the case that we're making is a massive job creation investment, a battery plant that will be opening about 7 miles from our site, looking at the wages that have been published in news articles of what those folks that will be working at that plant are anticipated to be paid, and then saying, those folks in those jobs, many of them cannot afford a market rate apartment, and therefore it's very important, economic development partner, that you're investing in this project so that we can ensure that they still have somewhere nearby that's a high quality place to live, and also lessens that burden on the community, which is already experiencing a shortage of housing. And so adding 1,700 new jobs will be a challenge for them to find places for all those folks to live. So coming at it, again, just through that economic development lens, trying to approach it as a talent attraction and retention opportunity, but still trying to tell that story of, housing is just one piece, right? So in this same project, we also need to have affordable childcare, because in order for folks to work in the jobs, they've got to be able to afford a high quality place for their children to go. And so using that ALICE data set, but also the wages from the Economic Development Agency to try to connect those dots and leverage additional sources of funds for the project.
Okay, we'll transition now to our final discussion point, which is, where are you in the process? And again, a couple related questions here. First is just literal, where are you in the process of your planning and acting solutions? And then reflectively thinking about, are there things you would do differently if you had to start again that don't necessarily have anything to do with COVID, because obviously that's been a big impact on a lot of the conversations we're having here, looking back over the last 3 to 5 years.
So where we're at is several places we're at. One, I've been approached to talk about TriShare. I guess I'm gonna talk about that at the breakout table. But the TriShare program was a state enacted program which separates child care costs between the state of Michigan, an employer, and the parent, right? 3 ways. So that was piloted at the state level. Regional hubs were established. We've worked with our regional hub provider, Southwest Child Care Resources, to move TriShare in our community. And we want to discuss like expansion. They've had some challenges because they come from child care background, engaging with private sector to get them on board with that. So that's on the table. Also working with a statewide group to educate folks and stakeholders around child care cooperatives as a business model, as a viable business model to address some of these issues. And then also working with Southwest Child Care Resources to support in-home providers. We've done this previously with some ARPA money but to do that again in terms of the business aspect of in-home child care provision and helping them with the business aspect. Something that I would change if I had to start all over, minus the COVID, in our community, it's a lot of talk about equity and transformation. We hear this over and over. I would do more level setting with folks to ensure that they understand that you don't get equity and transformation. It's neither quick nor cheap. You don't get equity at bargain basement prices. You pay full price for that. And so if the talk is to match what we really want to do, then we have to understand that, yes, this is not going to be quick. It's not going to be cheap. So do we still want to change or not? And so that's something I would, as I reflected, I would do better at level setting. I work for local government. It's inherently politically charged, on many levels. And so shiny object syndrome is a real thing for us, in addition to like the loudest voices. When I got hired in my position, some of the loudest voices at the time were talking about re-entry and folks coming from jail, from prison. We don't hear any of that anymore in our community to the extent when I got hired. So it's those type of things that, child care is an issue, but I always think, well, for how long, right? And so that's one thing I would change, is the better level set that, this isn't going to be quick, it's not going to be cheap, but it's inherently critical for a number of other things. So that's one thing I would definitely change.
So where we are in our process, we are trying to line up funding sources. We have secured our low-income housing tax credits, which was, maybe like 75% of the struggle, but we still have a long way to go. We've gotten a lot of our pre-development work done. We have a site and all of that. We have lots of great partners. So now we just have to, go through the 2+ years of development and construction. But for context, we've been working on this project for 6+ years. So these projects take a really long time. And to Kevin's point, it can be hard to sustain interest and commitment from entities that have lots of other things going on. And so I think that I agree with Kevin. That's something I would change, is a more sustained focus and deeper understanding of how long these things actually take if we really want to see systems change. That's not quick and it's not easy. But I also think I would say it is a both and. So like we need, to some degree, affordable housing, the LIHTC program is a Band-Aid solution, right? That's not the real reason that affordable housing is a struggle, but it's not like we can just stop having that program. So we need both and. We need the systems change, but we also need the Band-Aids that can create childcare spots and affordable housing today. I think we are, the project we're doing in Battle Creek is kind of like our 2.0. We did a project in Kalamazoo called the Creamery, which is about half the size and did include an affordable child care center in partnership with the YWCA of Kalamazoo. Also includes 24-hour drop-off care for folks working second and third shift in the neighborhood or who are experiencing emergencies. And that project was, I think most folks would agree, very, very successful, but there's still so many things that we're learning from that. We had a conversation with the director of education at the YWCA a couple months ago, and he was saying, there's obvious benefits from that co-location of childcare and affordable housing, but it's not enough to just co-locate those things, right? Because again, when you think about that Alice report and the household budget, you're solving for 2 of like 20 different things that folks have to account for. So we need transportation, we need access to groceries that are affordable. So it's a much bigger holistic approach that really is needed. And so in the Battle Creek project, we are trying to think a little bit bigger and bring more partners to the table. Instead of just doing childcare, we're trying to do a broader community center with lots of additional partners and on-site services. But it's a challenge. There's so many different stakeholders. Everyone has their own interests. You have to figure out how to tell your story to align with whomever you're speaking with. so I don't really know that I would do anything different. I think it's just go in with your eyes open and really know it's not quick, it's not easy, and you're going to have to continually tell your story over and over and over again to sustain the interest of partners who have other interests and are likely to potentially move on to other issues.
Wow, big question. Right now, we are at the stage where we are taking the information, the data that we have, and using it to plan and strategize for teacher support, ongoing fidelity to the curriculum, and providing ways that we can address the low domains, and planning strategically for classroom support. So it's ongoing. We've carved out time for every teacher throughout the course of the week to have a session with the education coordinator in supporting how to implement these changes that are going to up those domains that are lacking. So looking at literacy, doing Mighty Minutes, I'm getting way into the weeds, but it's curriculum based. So we're finding ways to help support those deficits that we see. And we're getting ready to present to our Guadalupe Center's board at the end of the month as to where we are with our project. And if I could do things differently, maybe it would be to involve universities, colleges, and lean a little bit more on Dr. Tony for looking at teacher qualifications. That's one of her points, and I know we're all looking at our workforce and how can we make that process of supporting qualified teachers in the field of early learning and giving them everything that they need to be impactful once they're hired by an early learning center.
So connecting the pieces is in the third quarter of a 1 year project. So we're nearing the finish line. So we started off with adopting a framework, international framework for our high performing early learning system, Dr. Kagan's et al. Work. And we collected data on, well, not data, we collaboratively thought about the assets, opportunities and gaps in our community related to the different components of that system, and then began to work in work groups to think about how our current assets could kind of close those gaps. And so lots of idea sharing and that sort of thing. And throughout that, I was really cautious to say, but we're not at the solutions part yet because we need to hear from the largest portion of the community that we can hear from, who will talk to us. And so in that, we started the process in February. In July, we had a community forum, and we shared our data points and sort of our early thinkings in each one of the categories. So the categories for the framework are policy and public engagement, services, funding, and governance. Quality, supported teachers and families. I'm trying to say them in order because the order was intentional. Quality, pedagogy, and data and metrics. And so the community, and that goes from like local government, parents, providers, state government, higher ed, school districts. We had a wide variety of stakeholders that attended, weighed in on where they saw the issues in their community and what they would like to be addressed. And after our data collection work, the community forum, we really realized that we wanted to work on workforce, though there are lots of different types of gaps in our early learning system, we can't begin to solve them if we do not have the workforce to support it. And so I think one of the things that I would do differently is to have an initial community forum pretty quickly, because although there was lots of great ideas that happened, I think hearing from the community, and we did put out a survey with, response rates or what they are, but we seemed to get more information from people when we had an in-person convening. And so doing that early on, I think would have would have made the work more efficient. And then also after the forum, many participants came to me and said, when are we going to do this again? But there was no plan to do it again. So my thought was, if we would have done one earlier and then that was the next one, then maybe that question, that expectation of another one wouldn't happen. But we'll do something again for the community for sure. So we are, on the 30th, we have our Q3 steering committee meeting where we're presenting to the steering committee the goals of the work groups and plans forward. And then we hope to, by early 2025, present these plans to our community. And I'm really excited about that.
Well, if I had it to do over again, I'd set up meetings with our local governments, city, county, state, and federal, in one room. Meetings with our employers and their employees in another room. And then meeting with our child care providers in another room, concurrently, get to a decision point and then bring them all together. Because when I try to stick them all in the same room, it was too much. And so we need to be able to have them, and then manage the time of the meetings. No more than an hour and a half. Eat, manage, have somebody taking book, because that was just so challenging to get everybody in the room, get them all on the same table, get them all at the same time, and then I hear from the people that's impacting. So we just needed to put them that way and then have someone help us facilitate that end meeting with recommendations. Because at the end of the day, what we say has to make sense to everybody. And sometimes it is what we want to hear them say, and sometimes it's not. And if everything is going on what you think, then something ain't right. And we don't need to just be pacifying. And so that was the main thing that we saw, that we could do it, and then set a time frame by which it's to happen, and then say, okay, we want to do this amount by this time, and everybody agree to it. But I think that was the thing with us. We tried to get everybody in the room at the same time, and it was too much. And so we just needed to do that, and then understand it's going to take some time, make sure we have that, but make sure we have all those things to validate. And the testimonials are tied to the people and vice versa. So we could not separate it. We had to bring it together. And that'll be what I would do different.
Bevan, I just want to check where we are in time. We have 5? Okay. I'm going to ask you each in a minute or less then to address one last question that will take us into the breakouts. And that is, in the past 3 years or so, what is one key lesson you've learned or weakness you've overcome? And again, this doesn't have to be the end all be all. Just throw the thought out there and we can continue it in the breakouts.
I'll just say that early learning touches all the systems. So whether you're looking at health, whether you're looking at entrepreneurship, women empowerment, public safety, transportation, housing, school readiness, workforce development, the list goes on and on. So the people who you can collaborate with to help solve the problems is a pretty large list. So so similar to think about the USDA as a funding source. I would say think about the people in your community that might not necessarily see their work related to early education, but it probably is impacted by early education or impacts early education in a way. So think broadly of who you could collaborate with.
I thought about this and I thought, what a great opportunity to say this. Don't be afraid. I would encourage everyone not to be afraid to ask for something that is outside of the structure of whatever it is. Because change doesn't happen from the top down. It happens from the bottom up. So keep that in mind. I've got lots of examples of things that we've been able to change for the good of the community that we serve and the families that we serve. So it's important to have that mindset. People know what is right, the right thing to do, and they want to help you. So don't be afraid.
I agree with that. I think that would be my lesson as well, is don't be afraid to take risks. Don't be afraid to take action. Even if you don't know all the things, have a perfect plan, have the model completely figured out. Every action we take is an opportunity to learn. But it's like that developer mindset, like, people need housing yesterday, people need childcare yesterday, and sometimes it's easy to feel like, well, we can't make that decision, we can't take that step until we've done A, B, C, and D. And sometimes we have to just go forward and take that risk and do our best and learn our lessons along the way so that we can do it better again the next time, but not to be afraid to just take some action and do something, even if you know that you don't know all the things, which is always going to be true.
Great minds think alike. That's what I was thinking about too, especially with the city government, which sometimes is heavily risk averse. So switching planning methods, right? To Michelle's point, especially at the city, is heavy front loading of planning, and like everything has to be A, B, and C, and it rarely survives first contact when you put in the wild. So a lesson learned is just more like prototyping. Learn by doing. You can engage people who have like a planning mind because we have some structure, but you can also engage people that say, man, we want to do something like immediately. It's like, okay, well, let's do something immediately, but have heavy learning elements involved in it so we can learn from it quickly and reiterate, right? Prototyping. And I've been in a lot of business spaces. They understand, like, our iPhones aren't the first versions of our iPhones. They went through many iterations to get that final product in your hand. So that's one thing I've learned, to have a structure where we can iterate and prototype solutions for families and then get feedback immediately and say, okay, 2.0 is going to look better. Just keep working with us and have them involved. So again, we can have that engagement and have the momentum going.
Clyde, any final thoughts? No? All right, well, I want to thank all of our panelists. It's been an amazing conversation. I feel very privileged to be able to moderate this discussion. So, Bevan, I'll hand it back to you.